Hello, my name is Nora Alexander, and I did my presentation on dentin hypersensitivity. So first off, what is dentin? So dentin is the piece of the tooth that's right under the enamel, and it's a porous mineralized connective tissue with an organic matrix of collagenous proteins and an inorganic component, the hydroxapatite. So my research question was, what are the causes of dentin hypersensitivity? And my hypothesis was, if a patient has dentin hypersensitivity, then the patient has a short, sharp pain coming from the exposed dentin because the pain patients have been suffering. I believe that the causes of dentin hypersensitivity is the loss of enamel, aging, bad dental care, the reduction of gums, and or the rising of a tooth. So first of all, who has this? It depends on the population to see who has it. For example, in a Nordic country, there is up to 79% of people that scarcely had a suffering from dentin hypersensitivity, then 25% that had it once a week, and 9% that had it every day. And the age range is between 20 and 59, and the highest part of that range is between 30 and 39. I was trying to find a correlation between gender and dentin hypersensitivity, but there is no correlation. So people who are at risk are people that have or do the following things: gingival recession, attached gingiva, prominent roots with a thin alveolar housing, toothbrush abrasion, periodontal surgery, excessive tooth cleaning, excessive flossing, routine dental cleaning, and periodontal therapy. So the most affected teeth are your premolars, which are the ones that are directly behind your pointy teeth or your canines. And then it's your incisors, which are your front four teeth. And then canines, and then your lastly is your molars, which are the last three teeth. And it's very unlikely for a baby to get dentin hypersensitivity because they don't have as much wear on their teeth as adults do, which is why it's most prevalent in adults rather than children. So this is just a picture showing you which teeth are which. So right here are the incisors, the first four. Right here are the canines in pink. Right here in yellow are the premolars, which are the ones that are most affected. And these are the molars in the back. So dentin hypersensitivity does a lot of things to different people. It may challenge you to do different things in your lifestyle, such as protecting your tooth with your tongue after eating a certain thing, or using the other side of your mouth to chew more often, and using different toothpaste and changing your dietary habits. It creates a pain in certain stimuli situations, such as cold, hot, air, touch, dietary acids, and other problems. So the etiology of dentin hypersensitivity is hydrodynamic theory. And the hydrodynamic theory is when outside stimulus, such as cold air, hot, or touch, makes contact with the exposed dentin. This then triggers the way that the dentinal fluid inside the tooth flows. And then this results in a pressure change throughout the dentin and starts the interdental nerve fibers to cause immediate pain. So hydrodynamic theory also explains that dental tubules are open at the top, which is right here where these little circles are. And this allows a clear route to the pulp, which is this nerve right here. It also means that the tubules become larger and more numerous and more open to things to come through them, such as liquids and air and touch. Since the tubules are more open, they are more of them, it is easier for fluids to come through them. And according to the law of fluids, it proves it to be true because fluid flows downward. And basically what the hydrodynamic theory is saying, the more things that go through your dentin tubule, the more things touching your odontoblast, which is this nerve right here, and more irritation and pain and sensitivity that you feel. One important thing to note is that this is not always the case for everyone, because you have to make sure you know the lifestyle and the health history of the patient, because it might be the symptoms of another disease or health problem. And there are some prevention methods. Despite there not being a cure, there are methods to prevent and treat this disease. So first is desensitizing the nerves, and then second is occlusion of open tubules to block the hydrodynamic mechanism. So these are just some examples of treatment. Novamin was the first treatment that they came up with, this is a brand of Novamin. And then Sensodyne is a desensitizing toothpaste. And there's also DuraShield, Biotine, and Crest and Colgate that have desensitizing toothpaste, but Sensodyne that's what they're known for. And other prevention methods in spite of using desensitizing toothpaste or Novamin, is to avoid using large amounts of dentifrice and reapplying it during brushing. Avoid medium or hard toothbrush bristles. Avoid overbrushing with excessive pressure or for an extended period of time. Avoid brushing teeth immediately after ingesting acidic foods, and avoid excessive flossing or improper use of interproximal cleaning devices. And avoid picking or scratching at the gum line using toothpicks inappropriately. So my conclusion is, my hypothesis wasn't completely true, but it was kind of true. It was true because it is a cause to dentin hypersensitivity, but it's the cause to the cause, which is the hydrodynamic theory. But it's false because I was not looking to research the cause to the cause, but I was looking for the main cause to dentin hypersensitivity. But however, I did find that hydrodynamic theory is the main cause of dentin hypersensitivity. This is just my works cited. I read 2 articles and I got a couple sources off online. So thank you for watching my presentation. I hope that you enjoyed it. My inspiration was the whole Congress as a whole, because it was very inspiring. Thank you.